Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to see Introduction to Neurology. So let's dig into it. Introduction to Neurology. So this is not exam oriented video. This is just to introduce your people to the neurology, how you have to study and what and all you are going to study under the neurology, how you have to approach. Because preferably like all we medicos feel that this neurology section is bit difficult. So let's crack it in a logical way so that we won't find any difficulty in studying neurology. So, and in that you need to be thorough with your basic anatomy related chapters in neurology, because everything goes with that, and a physiology where tracks and all everything. If you know what you say physiological part, the normal part, if you know, abnormal part will be easy. So I'll be trying to cover almost all the physiological part which is related to medicine, and if anything is lagging, and you can go and watch wherever it is available actually. So let's start the video. Neurology is a branch of medicine that deals with disorders of nervous system. The nervous system controls movement, sensation, cognition, coordination, and autoimmune functions. So it controls these many things, and anything related to these control system defect, we will study that in great detail. Then coming to division of nervous system, as usual from first year we are learning it. This is central nervous system, peripheral nervous system, and we have autonomic nervous system. And I think there is nothing much I need to say. Central involves brain and spinal cord, and peripheral involves cranial nerves, spinal nerves, nerve roots, and peripheral nerves. And in autonomic system, we have involuntary functions such as heart rate, blood pressure, bowel movement, and sweating. If you want, you can just go and brush up in first year or second year books. Mainly this division part is very well understood in the physiology ANS chapter. Then coming to functional organization, the motor system controls voluntary. You people know motor system always controls voluntary thing. Sensory always controls sensations such as pain, touch, temperature, and proprioception. Higher cortical functions includes speech, memory, behavior, and consciences. Cerebellar system maintains coordination and balance. Cerebellum, it's important. We will learn that part in great detail. I'll try to make even anatomy videos if possible. Then common neurological symptoms. Patient with neurological disorder may present with weakness. Most common patient comes with this symptom in your casualty. Weakness, like he'll be waking normally yesterday, but again after sleeping to yesterday night and morning he'll feel there is some weakness and he'll neglect it sometimes, or the patient may come in that time only, and the patient may neglect and he'll come to casualty after 3 to 4 days, whether at that time it will be very late to treat the patient. So you have to read, like ask the patient when it occurred actually, and all. Don't worry, I'll be teaching you people how you have to take the case also. Sensory loss, seizures, headache, gait disturbance, speech difficulty, visual problems, or loss of consciousness. This loss of consciousness is important when there is a trauma or sudden fall of the patient. Then basic principles of neurological diagnosis. You have two fundamental steps, where first you need to go with the anatomical localization, then you have to go with the etiological diagnosis. Why it is important, you will understand by going down the video. So step 1, as I said, it is anatomical localization. So localization involves identifying the site of the lesion based on the clinical features. So possible sites may be cerebral cortex, subcortical structure, brainstem, spinal cord, anterior horn cell, nerve root, peripheral nerve, neuromuscular junction, and muscle. This is why I told your anatomy should be strong and your physiology knowledge should be strong, so that you won't get confused when they ask you about unilateral, bilateral, left to right, contralateral, decussations and all. You have to be thorough with your anatomy and physiology. Wherever it is required sufficient amount, I will be teaching you people. No need to worry. Then coming to, what do you say? You have to correctly localize explains multiple symptoms with a single lesion. So you have to be careful while taking history. Then coming to etiological diagnosis, once the lesion is localized, first you have to localize where it may be. You have to suspect where it may be the lesion. Then you can give the patient proper investigation so that you will diagnose it properly without missing any point. The underlying cause is identified. So common etiology will be vascular. Strokes, important topic. We'll be discussing it very great detail. Don't worry. And infections, some infections causes seizures and all. We'll be looking into it. Inflammatory, neoplastic, even it causes seizures most commonly. Then degenerative, Parkinson, Alzheimer's. Then metabolic, toxic, and genetics. Then coming to history taking in neurology, it is like one of the biggest history taking part in medicine. The one who are watching, who are studying in second year or third year, you'll be understanding why I said it is the biggest, because if you write this case history properly, most probably examiners won't ask you much of the questions outside this case history what you wrote actually. If you explain that, you'll be fetching most of the good marks in by the examiner in your final and even in internal practicals. So history of taking in neurology, onset, you have to sudden onset suggest vascular causes. Gradual onset usually suggests tumor or degenerative disorder, because tumor and degenerative disorders require time to grow, or like it has to occur, it needs time. So gradual onset usually suspects tumors and degenerative disorders. Vascular, a clot may come from somewhere and it may deposit and it may cause the symptoms suddenly. Your like patients will be saying morning it was fine, after afternoon suddenly after eating food I got weakness in my right limb, left limb, lower limb and all, they'll be complaining. So you have to suspect it is a vascular because it is sudden. Then course, it may be acute, progressive, relapsing, re-emitting or static. Then distribution, unilateral, bilateral, symmetrical. As I said, unilateral, bilateral, symmetrical or asymmetrical involvement. Then coming to neurological examination overview. A complete neurological examination includes assessment of higher mental functions. See, when it comes to neurological examination, there are some subtopics you need to include under your case history, even though the examiner didn't ask you to do that. What are those? Higher mental functions you have to check, then cranial nerves, then motor system, sensory system, reflexes, cerebellar function, and gait. These are complete neurological examination you have to do when the examiner asks you to do a neurological examination. Then importance of localization. Why it is necessary to localize it? Because localization narrows differential diagnosis, guides investigations, and simplifies management. If you localize the disease, you can manage it quickly and you can prevent patient from further progression into damages, destructions. So localizing plays vital role. A good neurological examination often provides a diagnosis even before imaging. See, in neurology, most preferably we go with a CT or MRI most commonly and angios. But if you take a case history properly and localize the thing, you can ask the patient directly go with that particular investigation, so that time will be saved. And if any window period is there, we can save the patient, or we can even reduce the risk and preventions to further complications. Okay. Clinical examples: sudden onset hemiplegia suggests stroke. As I explained, like weakness in limb or something, it will be suspecting stroke. Then ascending paralysis suggests Guillain-Barré syndrome. We'll discuss this in great detail. 5 marker, very important topic. Even in clinically, rarely we see it, but when it comes in a huge number. So let's discuss it in great detail. Then fluctuating weakness suggests myasthenia gravis. I think this is one topic you are studying from first year in physiology, then in second year pharmacology, then it comes in medicine also. So let's make it integrated. I'll make this video on the myasthenia gravis integratedly. Then progressive headache with focal deficit suggests brain tumor. Okay, particularly there is some compression happening to the surrounding structure by a foci, maybe suspecting brain tumor. Neurology is a localization based discipline, a structured approach involving careful history taking, examination, and localization makes neurological diagnosis simple and logical. As I said, taking history plays vital role, and giving a logical examination gives proper management history. So what you need to take home message from this video is always localize before labeling the disease, because if you localize, you can label the disease properly without any doubt. History provides maximum diagnostic clues. This is the only discipline where examination plays important role over investigations. Examination is more important than investigations, as I said. I think there was nothing to revise more. Just remember, you have to do it in a 2 phase: anatomical localization, then etiological diagnosis. And every time you have to remember, neurology is bit difficult if you don't have the basics. So I'll try to incorporate almost all the anatomy part and even physiology part, pharmacological part, wherever it is necessary in a sufficient way so that you fetch good marks in your exams and you'll get a important knowledge. See, I know when you come to final year, you'll be having different big platforms to watch for knowledge. So let's not make that big videos. So I'll try to make it small so that during your exam you can't go and watch those videos 2 to 3 hours videos of single topic, but you can make my topic, my video notes, and you can study for your final exam. So let's keep that motto in my YouTube channel, and I'll be helping you people for your final exams too. Okay, I think that was a quick review of neurology. I think everyone understood what is neurology. And